And Dr. Ziv Cohen, a forensic psychiatrist from Cornell University Medical Center, is joining us now. Thank you very much, Dr. Cohen, for speaking to us. So we've just seen a report on Itzik Saidian. There's no doubt that awareness on the mental state of soldiers and the issue of PTSD, again, the awareness surrounding it has been on the rise. But my question to you, are we able to treat it better?
Well, it can be a very difficult disorder to treat. So, PTSD is on a spectrum, and some people have mild cases, some people have very severe cases like Itzik Saidian. So on the mild spectrum, it's relatively easy to treat. Patients often even get better without a lot of treatment. But I think what the challenge is for the IDF veterans who have severe PTSD, there aren't enough resources for treating them. So, if they can go privately and spend, a lot of money, which a lot of people can't afford. So I think ultimately it comes down to an issue of resources, making sure that they can get the treatment they need.
And on the individual level, Dr. Cohen, how difficult it is for soldiers to make the first step to, quote unquote, admit they need or want mental support?
So that's a really hard issue with PTSD. When you have PTSD, you tend to avoid things that trigger your PTSD. And one of the things that can really trigger PTSD is remembering what happened to you and talking about what happened to you. So it creates a catch-22 for the veterans, where the only way to get better is to actually address it head on by talking about it, and yet that's the last thing they want to do. So very often it is family members and loved ones, spouses, kids even, that are bringing the veteran in for treatment. And so I think, I really encourage families to not give up, even if the veteran is refusing treatment. Be persistent. It may pay off in the end.
And that truly brings me to the last question we have for you, Doctor. If there are family members, friends, or soldiers themselves who are watching now and consider getting help for their loved ones or themselves, you're saying be consistent, but what would you recommend being the right first step?
Well, I think it's pointing out to the person that it seems like they're, that like they need help. Sometimes people are very sensitive. If you say, I think you need to go see a therapist, I think you need therapy. Some people are sensitive. They don't like that. So you might say, look, you seem like you've been under a lot of stress, or we all know that you're not quite yourself since you came back from your combat service. Maybe we can, and then see if you can find someone who's trusted. So it doesn't have to be a therapist at first. It could be a family doctor that the person trusts, where they can have those first conversations.